Hi guys, I thought I'd just go out for a walk to try and get some, I've just had some pain relief to try and push in the pain relief again. I'm still flaring really hard. No change from this morning. This morning I was very tearful. So I thought I better just try and make an effort, have a shower, do my hair, put some lipstick on, make myself feel better, wear some nice colours, make myself feel better. But the reason why I want to talk today is I want to talk about the diagnosis of interstitial cystitis, IC. I want to dispel this myth about this disease because it doesn't exist. Basically, interstitial cystitis, I can't even say it, IC, is when you've had all the tests and you've been given lots of short courses, 3-day courses of antibiotics, and urologists are kind of like, oh, I don't know what to do with you. They've scanned your vagina, they've scanned inside, done an ultrasound and everything, and they say, oh, well, can't see any problems here. Then they will diagnose you lightly with IC, which basically means you've got cystitis for the rest of your life and it's not curable. We don't know what's caused it, but it's not curable. Can you believe that? And I want to dispel the myth right now that this is a load of BS, okay? And I follow, obviously, Professor Malone Lee's treatment protocol. And if you want to, in my last blog I was talking about his level of experience in treating this. But we are firmly, oh God, it's so light here. We are firmly against the diagnosis of IC because it's like, oh, well, it's come out of nowhere and it's incurable. Basically, there is an infection there, but it's hiding. That's what an embedded infection is. It hides. So when you get lots of short courses of antibiotics back to back, the infection becomes quite clever and it hides itself in the bladder wall and becomes a biofilm. And a biofilm is a very strong build-up, kind of invincible bacteria wall. I mean, I don't know much more about it, but it's just like it's freaking strong anyway. So the way you've got to treat it is, well, Professor Lee Malone's protocol is, like I said, high dose antibiotics for a longer period of time. So I want to dispel that myth about IC. Now, there are lots of different treatment protocols out there. I'm just following one of them at the moment, but I will be discussing about others. I think some people I've spoken to, they've had operations and things, and then it's come back. Great. Some people, they've had operations and it's worked. There's something called like fulguration, which everybody's talking about, it seems, on different UTI forums at the minute. I don't know much about this, but I know there's a few surgeons that do this, one in Turkey, Dr. S, and I'm still looking into this. I'm not so confident on this procedure, if I'm quite honest, because I don't like the thought of being opened up and then being operated on and then having to have another operation. But I don't know. I mean, I'm 3 years into this, maybe 4 years, 5 years into this, which hopefully I won't be 4 or 5 years into this. I'll think differently. I just think until you're in somebody else's shoes and in that situation, you don't know what choices you'll consider. And Yeah, so bladder fulguration is where they kind of like get a hoop type thing, and they kind of, there's stuff called plaques in the bladder. Well, you get plaques in the bladder and in the trigone, which they believe is built up from excessive amounts of discharge in girls when they're young children. So, I mean, this guy, this Dr. S, he's performed it, I think, on around 500 women, 15 of which have come back. This is from my reading of an interview with him. 15 have come back to have the operation done again 5 years later. And it costs about £2,000, and you've got to get over there, obviously. I mean, the price of health, I can't put a price on that, to be honest. I currently am spending quite a bit of money on this. Every time I meet up with Professor Malone's clinic, it's 200 quid every 3 months. If I'm feeling I'm not very well and I'm flaring like I am now, and I'm thinking my counts might be really high, might be high because I've got a slight fever, or might be high because I need a change in medication, then I can go for a pee and flea. I discussed this in my last video, and that costs around £50, so that's not too bad. I'm in the park. It's nice. I like being around children because I don't have any myself, and I actually find them quite funny and quite just quite beautiful in their innocence and stuff. So it's quite nice seeing the happy side to children in a park. I know there can, from being with my friends and that, there can be a lot of hard work, but yeah, I don't know how women deal with this and children and work full time, but we deal with an awful lot, and I'm fed up of that. I'm fed up of women dealing with all of this. Men deal with it as well, but this is mostly a condition that affects women. So yeah, that's dispelling the myth about IC. It doesn't exist. There's no such thing. Embedded UTI, yes. Chronic UTI, yes. Now, frequent UTIs. People that have frequent UTIs, that's normally because the initial UTI has never been treated. So it's embedded. It keeps coming back, keeps presenting itself, because it's normally embedded. So you need to book an appointment, ideally, if you're UK based, with Professor Malone Lee or anyone in his clinic in Harley Street. In America, you've got somebody called Dr. Bundick, and he follows the same protocol as Professor. You've got also various other clinicians. You've got Dr. Anderson, I believe, who's a female specialist in this condition, based in the UK. There's a few anyway. I just think when I'm like this at the moment, I have to really count my blessings that, for one, I live close to London. I can get there quite easily. I can use the toilet if I need to on the train. Other people, it's very hard travelling. Sometimes if I've got an event coming up, the stress of the event makes my symptoms worse. Yeah, I know, that sounds mad. So sometimes I think, stress is not meant to help, it's meant to raise the levels of infection. But life is stressful, we can't help but get stressed sometimes. So I think with this, it's about learning to shift your mindset. And that's what I'm really going to try and do this year, is shift my mindset, because when I start saying I can't, I'm weak, I can't do this anymore, my body starts thinking, yeah, you can't do it anymore. And I need to just go, yeah, I'm going to really try. I'm going to be open-minded to this. I find it very difficult, for example, when people say, have you tried this? Have you tried cranberry? Have you tried bicarbonate soda? Have you tried them little sachet things? Yeah. I've tried it all, mate. It doesn't work. Makes me worse actually. Something that is quite beneficial to people is something called D-mannose, and you can get that in powder form, and that's particularly helpful for E. coli bacteria. But I'm not sure what kind of bacteria I have, but I have tried D-mannose and I found it actually made me worse. My frequency was through the roof. So my symptoms are frequency, urgency and pressure constantly, and my symptoms increase when I ovulate and just before I come on my period, but like now it's just 24/7 non-stop. So my symptoms get really bad at night. So about now, as we hit kind of 5 o'clock, is when my symptoms start to really, I know where I'm going to be tonight, which is going to be all up all night. A wee in a bowl next to my bed. Yeah, it's not very pleasant. And you know, I haven't slept in the same bed as my partner for I don't know how many years. I never really was a fan of sleeping with men in beds anyway, to be honest, because they just take up too much bloody room, and I need to sleep. Sounds bad, doesn't it? It's true. And yeah, so, but it is, I'm not going to use that phrase because I can't stand it. It is what it is. No, I can't stand it. It's not it is what it is. I'm going to make it better. And that's what I'm going to do. So I'm trying to keep my head open-minded to new suggestions and things. But sometimes be mindful, please, when you're giving suggestions to someone with a chronic illness. Oh, have you tried this? Have you tried? And they've been suffering for years. Don't think that they haven't tried it, and be sensitive. Be tactful as to how you give advice, because sometimes people aren't ready to accept your advice, and you might think you're doing the right thing, but actually they're on their treatment protocol, and just because they're not recovering at the time that you want them to recover, or you don't think is a correct recovery time, doesn't mean that their treatment isn't working. It's just we're all very different, and how we heal is very individual. So yeah, I'm in the park right now. Can you see? This is Wardown Park. It's really nice. So this is a park where I used to go a lot as a child with my dad. So yeah, it's quite nice. It's just nice being in nature. Actually, it's nice being in nature. Also, kind of, you know, some people, another thing to look out for, I'm kind of talking to people that also care for people with this diagnosis. Maybe don't keep asking them how they are doing, because we're actually doing not very good, and you keep asking us as a reminder as to how shit we're doing at that point in time. Maybe just talk about things, other things. It's nice to talk about other things. It's like I like learning about my friends and things that they're going through, different problems they're going through in life, how I can help them. Because then, you know, I feel like a normal human being, helpful. This is why I kind of am doing this blog, because I feel quite lonely with this. Yeah, I've got lots of kind of friends and that on these forums, but I never see them face to face, and you can't beat face to face contact, and I'm not really getting that because of the lockdown and all of that, but also because I can't really go out, and that really sucks, man. I just want to go out and go raving or something, but I can't really do that. I have to behave myself, which really sucks. So don't take your body for granted is another thing I will say. Treat it with respect. I'm in so much pain, but I'm walking, I'm in nature, and I'm good. I can use my body, focus on my strengths. I can walk, I've got legs, I've got arms, other people don't. have this, so I am thankful. Suffering is part of life, and this is all impermanent, and that's what we've got to think.